RFK Jr.'s dreams have come true. He has successfully changed the vaccine schedule so that instead of recommending protecting all children from 17 diseases, now it recommends only 11. Now, to be clear, this change was not based on any new data. There was no new safety finding or analysis. It wasn't even discussed at the typical public vaccine advisory meetings. This was all behind closed doors, through the direct administrative authority of people that RFK Jr. directly appointed. So much for radical transparency. This was planned, of course. When RFK Jr. fired the prior CDC director, Dr. Susan Menares, she then testified to Congress that he had secretly asked her to approve changes to the childhood vaccine schedule, even without evidence.
My tenure as CDC director lasted 29 days. Since my removal, several explanations have been offered: that I told the secretary I would resign, that I was not aligned with administration priorities, or that I was untrustworthy. None of those reflect what actually happened. On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed. Regarding trustworthiness, I cannot define that word for Secretary Kennedy. I made commitments to this committee that I would lead with integrity, transparency, purpose, and work with Congress to maximize health outcomes and protect the American people. Secretary Kennedy told me he could not trust me. I had refused to commit to approving vaccine recommendations without evidence, fire career officials without cause, or resign, and I had shared my concerns with this committee. I could have stayed silent, agreed to the demands, and no one would have known. I could have kept the office, the title, but I would have lost the one thing that cannot be replaced: my integrity. Some may question my motives or mischaracterize my words. That is part of public life, but I am not here as a politician. I'm here as a scientist, a public servant, and a parent committed to protecting the health of future generations. The question before us is whether we will keep faith with our children and grandchildren, ensuring they remain safe from the diseases we fought so hard to defeat.
So he fired her, and he replaced her with someone who would follow his directives. Fast forward to this week, and that person he appointed signed off on cutting universal vaccine recommendations from 17 diseases down to 11. Now, the problem with these switches away from broadly recommended vaccines to risk-based approaches is that you often can't tell which children are going to get very sick. Take rotavirus as one good example. It used to be universally recommended for all children. Now it's been downgraded to shared decision-making, which essentially means guess whether your child is at risk. It's an oral vaccine, by the way. There's no injection. Not that that matters too much. A risk-based approach here would make sense if hospitalized children had predictable medical conditions. But they don't. More than 80% of children hospitalized with rotavirus have zero other underlying medical conditions. Before the vaccine, about 200,000 children went to the ER each year in the US with rotavirus, and around 50 to 70,000 of them were hospitalized. Every year, 50 to 70,000 children hospitalized. Then the vaccine became available, which dramatically cut those numbers. It reduces risk of severe disease and hospitalization by 80%. But oddly enough, in RFK Jr.'s team's report, they don't spend much time talking about hospitalizations in the rotavirus section. Instead, they talk about deaths. And they play down the risk for rotavirus by saying that very few children died per year from rotavirus. And that's actually technically true. Death from rotavirus was uncommon. But that misses the point that it's a really big deal if hundreds of thousands of kids are going to the ER each year. I mean, as a parent of a 2-year-old, I can tell you that I don't just want her to not die. I also want her to not be hospitalized for multiple days with vomiting and diarrhea so bad that she can't eat or drink, and therefore severe dehydration with a virus that's causing her intestinal cells to die and slough off and fail to absorb water and nutrients. I want to avoid that for her, even if she wasn't going to die. Now, overall, RFK Jr.'s team makes a big show by claiming that they're just aligning U.S. policy with peer countries. And the report has this screenshot of an Excel spreadsheet where they're counting up how many diseases each country vaccinates against, as if all health systems are comparable. But even in their own data, in that screenshot of Excel, most peer countries recommend vaccinating against around 13 to 16 diseases. The U.S. was at 17 if you include flu and COVID. And if you look at just the routine childhood vaccines, you don't count flu and COVID, the U.S. actually looked almost identical to the majority of those peer countries. But of course, they weren't interested in actually aligning with peer countries, so instead they cherry-picked the lowest number on the list, Denmark, for their inspiration. Denmark, for example, does not routinely recommend rotavirus vaccination for all children, but 17 of the other 19 countries in the list do recommend universal vaccination for rotavirus. So which did they choose? Denmark, of course. And by the way, this is probably obvious, but comparing the United States to Denmark healthcare system makes no sense. Denmark has universal healthcare, integrated medical records, very low barriers to care. In the United States, families often have to decide whether going to the doctor is worth the bill for hundreds of dollars, even if your child is sick. Our systems are built differently, and vaccine policy has always accounted for those differences. The core problem is simple. RFK Jr. and his team first decided to slash vaccines. They started with their conclusion, and then they went hunting for justifications. Of course, when they couldn't find any scientific evidence to support their conclusion, they started counting up vaccine doses in Excel. And they didn't even do a very good job of that, so they just picked the country with the fewest vaccines and said, we're going to go do that. This is the opposite of evidence-based public health. These changes in recommendation status will only serve to introduce confusion, hesitancy, ultimately harm for children, all because RFK Jr. has been given the unilateral authority to dictate U.S. vaccine policy, apparently with no requirement for evidence to justify his changes. For parents, you should know that the American Academy of Pediatrics still publishes the evidence-based childhood vaccine schedule. The vaccines remain covered by insurance. You should still trust your pediatrician to have your child's health as their top priority. I can't say the same for RFK Jr.